Once we determine a plan of care for each patient, and this will be different for each individual patient, the patient will need further testing, like an echocardiogram, or sometimes we need to look how the coronary artery is doing what is called an angiogram.
I work closely with our doctors in our heart failure team. We do a lot of one-on-one teaching with our patients. They come in, they meet the doctor, and they meet with our pharmacy team. And then we as nurses get to sit down with them and go over education, talk with them about nutrition, talk to them about the diagnosis of heart failure and what that means. And we're gonna manage your heart care through your medications at home. So we're gonna make sure that you're taking your medications every day as you should, as prescribed by the doctor.
Overall, we have 3 main goals for the use of these medications. The first one being to prolong life, the second being to prevent hospitalization related to heart failure, and then lastly, to help control symptoms.
Most of the time for the heart failure patients, we need to evaluate whether they are in the right medical therapy. If we see that there are areas that can be improved, then we work with the patient to closely adjust the medication. Sometimes we also use remote care. We can get blood pressure readings from a blood pressure cuff that the patient can get at their home. They can check their weight regularly, and then connecting with the patient remotely and assessing these variables over time, that help us to adjust the treatment of the patient more effectively. We can decrease the amount of time that it takes for the treatment of a patient to be optimized. And this is very important because the earlier that we optimize the treatment, the better that the outcomes are going to be on the longer term, although we can define what are the next steps.